The information is power, and we don't want people to be powerless. And that is what I see with people dealing with any kind of disease, but cancer is just one that is highlighted right now. Is that if you don't take charge of your own health, and if you don't become the driver of your own health.
Hello, everybody. This is Dr. Kevin Connors. Welcome to another episode of Connors Clinic Live. Today, we're interviewing a special guest who's become a friend of mine, Dr. Michael Karlfeldt. He is running the Karlfeldt Clinic out on the West Coast, far away from where we are. And we're going to talk more about what he does in his clinic and what he can bring to the table. We always believe that there's a lot of pieces to the puzzle when you're trying to heal. And you need to utilize every piece that you can, or wherever you feel like God is leading you. So I try to introduce you to great practitioners, people that I think are good and add great pieces to the puzzle. So, Dr. Michael, how are you today?
I'm doing good. Thank you so much for having me, Dr. Connors. This is going to be great. I'm excited.
Yes. So give us a little more of a rundown of your clinic, where you're located, how people can contact you, and then let's get into some things that we want to chat about.
Yeah, my clinic is pretty unique. I mean, one of the things that we offer is the photodynamic therapy, and I know we talked a little bit about that before. But the key with photodynamic therapy in regards to cancer specifically is to be able to target the cancer directly without harming healthy cells. And you can use a combination of what's called a photosensitizer to do that. And so the trick is to get a photosensitizer that tends to accumulate in the tumor. And then we can then use a laser. So we do intravenous, we do interstitial, where you bring needles down to the tumor, and in order to be able to oxidize the tumor. So that is the key component of why people fly from a little bit all over the place to do the therapies I do. And then we do a bunch of other things as well, because cancer, as you know, it's a complex disease. So you need to address it on so many different levels. You can't just do kind of one hit wonder and think that that's going to take care of it. You need to kind of lean on it from all these different angles, and that's what I pride myself in doing here at the Karlfeldt Center, because we offer just so many different therapies to kind of lean on cancer, both spiritually, emotionally, physically, and so we do a whole body approach that I know you do with what you're doing.
So now, I know we spoke about the photodynamic therapy before, but that's becoming more of a foundational piece of your clinic. I had some patients ask me on our Zoom call about that and what you do. Is it better for more surface tumors? Is it still work for a deep tumor? Tell us a little bit about that.
Yeah, so photodynamic therapy has been around for a long time, but the challenge has been to be able to get the photosensitizer and the light to the site of the tumor, enough of the laser light to the tumor to have an effect. So what has been done in the past, because of those challenges, has been mostly surface tumors like melanomas, any kind of skin cancer, even throat. They've been able to do that. But with newer technology that has been brought in that we're utilizing here at the center, we then have the ability then to bring interstitial needles, optic needles, then to the tumor site, and then surround the tumor then with the laser light, so we can hit it from several angles at the same time, and then also you can inject then the dye around the tumor site and allow that absorption. And also it has to do with the type of dye that has been used, and that is also something that has evolved quite a bit. So we brought in a number of things that we actually get from Germany that have most dyes in the past. And a dye, people can think of a dye, if you do you go and get a PET scan, they'll use a dye, in order to be able to get good imaging. It accumulates in the tumor cells. So the issue with that is that dye then, goes out of the system quite quickly, so it doesn't stay in the tumor for a long period of time. If you take an image the next day, you wouldn't be able to really see that accumulation within the tumor. The evolution of dye that I'm using, and this good friend of mine works at a university in Germany that developed this specific one's called nano ICG, that is structured in a way so that over time it accumulates in the tumor cell and it stays there for a longer period of time, which gives us the opportunity to treat that tumor for a longer period of time with the optic therapies. So that becomes the beauty. And then obviously you have then tumors that are in locations, like in the lungs. We don't want to stick a needle into the lung, but we can then use a very strong laser then externally, as long as there's enough dye within that tumor, and then be able to get enough kind of juice, so to say, into the tumor, even though we're not sticking a needle into it, to trigger reactive oxygen species. So you can do that with both laser, and then you can also combine that with ultrasound, because ultrasound also functions like it triggers the creation of reactive oxygen species and what's called cavitation bubbles within the tumor to trigger killing of the tumor cells. So there are technologies, and that is the beauty of what we do, that is quite cutting edge, is to utilize these technologies to be able to treat deeper seated tumors, versus just the ones that are superficial.
How often do you have to do that procedure? Then is it something you do daily, multiple times a day, and then how many minutes is each session?
So what we do, so people tend to come here and they stay here for a couple of weeks. And so in the beginning of those couple of weeks, the first couple of days, that is when we introduce the photosensitizers. And then we treat that every day. So that way we treat it with ultrasound, we treat it with intravenous and external laser every day. Also use a very powerful laser bed with 1800 watts, to really kind of get as much light and juice into that tumor to cause as much creation of reactive oxygen species to trigger that cell death. So, so we want to kind of lean on that tumor as much as possible.
Is the IV therapy that you're doing, is that just in addition to that? It's not laser IV, obviously. It's that you're doing something with nutrients IV therapy that you mentioned?
Yeah, so we do nutrients in addition to the intravenous laser therapy. And the beauty with the laser therapy is that you are able then to treat the blood as it's passing by. So you're treating the whole, and the blood passes by one spot, the body about once every minute. So and we treat for about an hour, which means that you're able to treat the whole blood volume then for a whole hour, and for about 60 times, and in that hour. And so in your blood, what you have there is that you have things like, circulating tumor cells, you have, cancer stem cells, that are there. And so by treating then the blood and killing those circulating tumor cells and the cancer stem cells, you are then, as they die, then the immune system is able to recognize them better and then trigger then an appropriate antibody response, to those specific components. And the beauty is that you're treating exactly the cancer stem cells that are in the body at that time and the circulating tumor cells that are at that time. So you're actually allowing then the body to create like the perfect vaccine, using that very kind of contained system type of treatment, with optic needle into your vein, treating the blood as it's passing by. And then we combine that with other nutritional substances, that are also putting pressure on the cancer processes, like we do combination of poly-MVA and DCA. DCA is known to kind of help to shut down how the cancer cells are able then to get energy. So you are then starving the cancer. And the cancer is very vulnerable in regards to its energy because it is not very efficient in how it creates energy. So anytime you can then put pressure on how it's able to produce energy, it is then going to really suffer, and it's easier then to trigger oxidation. They're easier to kill if they are starving. So DCA, poly-MVA is a great combination to be able to do that. Poly-MVA is beautiful because it also works on the mitochondria of the cell. And with cancer cells, we know that the mitochondria is quite dysfunctional. And that is why the cancer cell is shifting its energy production into an alternate way, which is a fermentation type of way of creating energy. So the DCA blocks that fermentation component, and then poly-MVA will then push the mitochondria in its ability to produce energy. And the mitochondria, the beauty there is that it holds the key to the cell death switch. So when the mitochondria is functioning better, then the body is able to regulate better into kind of recognizing if this cell is too dysfunctional, then to cause that cell to die. Or if it's not dysfunctional enough, the mitochondria will then help to repair the genetic, the DNA, so that we will shift away from oncogenes or cancer-causing genes to more normal and healthy and kind of regular healthy cells. So that's just kind of one. And then we do curcumin IV, which is fantastic also in shutting down about 200 different cancer drivers. If that was a pharmaceutical drug, it would be worth many billions. But here we have it just natural. We can take it orally, and then when you do it IV wise, and the beauty there is that you get it directly into the bloodstream. It gets into the cells, and it just kind of bathes those cancer cells and shuts down all the kind of tumor necrosis factor B and NF-kappa B and VEGF and all these different drivers that the cancer rely on in order to be able to promote its own existence.
Do you then send people home with like poly-MVA orally, curcumin orally? Do you put a protocol together for them after they're there for 2 weeks?
Yeah, so all of this is then supported by diet and also a supplement program. And I do also use certain repurposed drugs, kind of like Jane McClelland, How to Start Cancer, where you can use things like low-dose naltrexone, ivermectin, fenbendazole, or membendazole. And then, and also sometimes you have that the cancer can have a very fungal component, like Doug Kaufman talks a lot about, the fungal correlation with cancer, and that it looks very similar to kind of fungal buds, and its behavior is very similar. So there's a strong correlation that we want to lean on, also making sure that there's some kind of fungal aspect over and above that it can be, so it can be a fungus or a tumor. So we want to kind of address all those different things. And so you have oral supplementations, repurposed drugs, diet, and then obviously lifestyle habits that we really want to lean into as well.
Do you have, in your clinic, do you have an option where people can do more telemedicine? Is that an option as well?
Absolutely, and that is usually where things start, and so I have people, doing telemedicine from all over, like you, I know you do, and so this way I can then interact with them, and if they feel that there's a need for them to come to the center for more intensive therapies, they can do that. But if we can then manage things from afar, then we can do that as well. And I can guide them in diet and supplementation. And then if they have then a local doctor that's willing to prescribe some of the repurposed drugs, and I can work hand in hand with them, or they can come then to the center for a period, and we can then kind of prescribe it there and then get some of the therapies here.
Yeah, I just love your philosophy of care. I think we think very much alike. You add pieces that I can't legally add. It's just complementary. Just fantastic what you do. Anything new that you see in the horizon in your mind of what you're wanting to add to your place, and anything that you see coming down the pike for alternative cancer?
Yeah, so one of the things that we are starting to look at, we've done a lot of what's called platelet-derived nanoparticle delivery of agents. So what that means is that we use the patient's own platelets. We mix those platelets, through a ultrasonic process with specific agents that we want to get into the tumor site. And then we do a microfiltration of that to make those, particles very small, very non-ionized, so that they can easily penetrate any kind of tissue. And the beauty with platelets is that tumors use platelets for their own benefit, and they are drawn to locations of inflammation. Obviously, the cancer tumor the tumor microenvironment is very inflammatory. So so it becomes a very powerful delivery system then of whatever agent that you want to get in there, whether you're using mistletoe or artesunate, or whether you want to bring in some peptides like thymosin alpha-1, to modulate that microenvironment. Or whether you want to kind of do a photosensitizer to kind of increase the concentration, like methylene blue or ICG or riboflavin, which are powerful photosensitizer. So that is what we've been doing for quite some time. The next step where we want to go is that if we have some people that are really really wanting chemotherapy or wanting some, but they don't want that big dose, they want a smaller dose of that, to just use a little bit of something like doxorubicin, and then to have that the delivery system of these non-ionized particles of the patient's platelets, to be able to then get the doxorubicin into the location of the tumor environment, instead of it then floating all over the place. And that way you can use a much less dose, and then also you can get it much more targeting. So it's similar to IPT, but I think it will take that to the next level. So we're kind of looking into that as a next step.
That's fantastic. I'm excited about everything that you do. I'm always intrigued when I talk to you and I learn something new, and it just motivates me to keep moving forward. So I thank you for bringing your wealth of knowledge to our patients. Anything else you'd like to share?
I mean, we have all these amazing therapies, but the key is to really understand kind of what are some of the underlying factors of what caused the cancer in the first place. So you do, in addition to then obviously going after the tumor, going after the cancer process, you want to look at the root cause. And that is where, I know you do beautifully yourself. And so that's when you want to look and see, what is driving this cancer? What is the fuel for that? Is it an emotional factor? Is it, chemicals, heavy metals? Is it pathogens? Talk a little bit about fungus. What is it that's underneath that? And so you cannot miss that aspect in addition to going after the cancer process in itself. So you want to have this multi-layered program, and that is why we do things like APN, it's called applied psychoneurobiology, where we use a muscle testing technique to pinpoint and see where traumas are stored and see where they're coming from. And then also you can then correlate that. So you have a little kind of homeopathic vial of the cancer. Like if you're dealing with prostate cancer, we'll have a little vial of that. And then you can then see which emotions, which traumas, where they're coming from. And it may not even be in this life. It may be, your parents' life or grandparents. It may have been a generational component that you have been helping to carry over time. So then you can pinpoint that and then use different techniques to help to release that charge, that trauma that's stored in the body. And so that you don't have that as a gravitation point for a tumor to form around. So that is the key. You want to kind of make your body not tumor friendly, and working on traumas, emotions, toxins, pathogens, eating well are huge factors in that. So that is just another aspect that we do.
Yeah, we talk to patients every day that their standard oncologist never, a cause never even comes up in conversation. I think the average person realizes that that's really silly. There was a reason that this happened. And if you don't fix that reason, even though you might, be able to zap the disease away, it's going to come back in some way, shape, or form and create another illness. And you have to change the milieu. You have to change the tumor surroundings, the body that created it in the first place. So I love that piece about what you do. A lot of alternative doctors kind of ignore that piece too. So
I think we get so excited and just that, we use natural agents sometimes, like a medical doctor use their pharmaceutical drugs, is that, this disease, that pill. And instead of looking at the individual as a whole and recognizing what is it that is underneath, instead of just, well, person has depression, or here's St. John's wort, or here's 5-HTP. Instead, we need to kind of look at the whole and understand, what is causing that depression. And obviously we can look at the emotional, but it could be a gut dysbiosis, or it could be, it can be toxic substances that they're exposed to, an inflammatory process that's triggered by something. And so that's why it's important to not just kind of think that here's a pill for this, but then to really understand what's going on with the individual to be able to address it fully, so that we're just not masking things, even just with natural agents.
Right. So the disease, the dysfunction is really just the manifestation of something deeper. We have to get to that something deeper.
Yeah. When people come here, I mean, they're busy pretty much from 8:30 till 5 o'clock, and there's just therapy after therapy, colonics, ionic foot bath. We do Hockett, we have flow presso working on the lymphatic, we have Sombol therapy, we have prayers for healing, we have all the different IVs, obviously the photodynamic we talked about. It's just a lot. And we also, the ultrasound and the it's scar therapies, neural therapy. It's a lot that happens when people come.
That's fantastic. And that's what people need. They need that intense approach sometimes.
Yeah, exactly. And I want the listeners also to know that there is a summit that's coming up, and I know that we have you on that summit. That's going to be some of the leaders in the world in regards to integrative oncology. And I mean, the lineup is just phenomenal of the speakers that are going to be on it. So for anyone that has any concern in regards to cancer, then the summit it starts airing October 31st, and it airs for free for a whole week. So all the listeners, they can join for free. Obviously, if you like the material and you want to revisit it, you can purchase it for a very small amount of money. But it's going to be an incredible event, and it's going to be some groundbreaking information. We have like yourself, Dr. Neil McKinney, Dr. Tony Jimenez, Dr. Paul Anderson, Dr. Thomas Seafried. People can look at the lineup, and I'm sure you'll provide a little link that people can go to kind of look at the lineup that's going to be there. It's going to be an incredible summit, and I'm really proud of it and excited, and it's going to be wonderful to share that information with the audience.
Yes, that's another thing I like about you, is that you just want to get information out and help as many people as possible.
Yeah, and I think like yourself, the information is power, and we don't want people to be powerless. And that is what I see with people dealing with any kind of disease, but cancer is just one that is highlighted right now. Is that if you don't take charge of your own health, and if you don't become the driver of your own health, you just kind of do like somebody that goes to the car mechanic and just drop off your car and then pick it up after the weekend. We can't do that with our bodies. We shouldn't just kind of take my body and fix it. We need to be engaged and involved in our own healing process. And with that education and knowledge, like your podcast that you're doing, becomes so important, so that we can then be involved and empower ourselves and empower our bodies, that God-given energy that we have, and use that to truly heal and be whole individuals.
Amen to that. Yes, 100%. Well, thank you so much. We're going to have links to your clinic and to your summit coming up, so that's going to be very exciting too. Dr. Karlfeldt, I thank you for your wisdom and all that you offer people. Just ask that God just continues to bless you in your practice and your patients, and that healing can ensue.
Thank you so much, and you're such a blessing to the world, with everything that you do, and it's an honor to know you, and an honor to work alongside with you with people on their healing journey. So thank you, and I also want to let people know that in October I'm releasing my book that's coming out. It's a thick 450-page book about everything about cancer and what you need to know to empower yourself. So, for all the listeners, keep an eye out for that as well.
Yes, looking forward to that. We'll have links to that when that comes due too.
Great. Well, thank you so much, Dr. Connors. Always an honor.
All right. Bye-bye.
Bye.